Hi everyone, I hope you're doing well. This is my fourth time trying to make this video today, so hopefully I can get it done without any interruptions this time. So I wanted to introduce the second book that I highly recommend to patients when I'm treating a neck problem. I did post a few days ago some pictures out of this book that I'm going to just show you what they are again. So this page shows some patterns of distribution of some symptoms that can occur that come from the cervical spine. These types of symptoms will usually come on because of some issue going on at anywhere between C4 to C7. Okay, and anytime somebody has a cervical problem, which cervical means neck, anytime somebody has a neck problem, I'm always going to assess the thoracic spine as well. So for those of you who have had physical therapy or chiropractic care in the past, and you still did not get complete resolution of your symptoms, then likely the clinician that you worked with didn't know about a concept called directional preference of movement. I'm certified in a technique called mechanical diagnosis and therapy, and one of the main things that makes this technique so successful is knowing how to assess what's called directional preference of movement. And what that means is some movements will turn symptoms on and some movements will turn symptoms off. Okay, here's the other page that I wanted to just reiterate, and that those are symptoms that can be produced in these different patterns related to symptoms being generated in the upper cervical spine, which would include C1, 2, and C3. So those are your upper three vertebrae in your neck. And those symptoms can be anything under the sun. So symptoms in the head, it could be, anything from mild tension headache or something that feels like a mild tension headache, to a full-blown headache, and then of course acute headaches that we call migraine headaches. For those of you who have history of migraine headaches, you might be really familiar with the medications that are prescribed for that condition, but you might have also come to a realization that those medications don't cure your migraine headaches. They just help you to manage the symptoms that you have. They might not even take away all of the symptoms that you have. They might only reduce them, to a degree that makes it bearable to get through this acute type of headache. Also, some other things to consider regarding migraine headaches are food sensitivities, allergies, or food intolerances. When I say food, we're also including beverages in that. So foods and beverages can be irritants that result in headaches. Food and beverages can also be irritants that affect our pelvic health. So that's one of the other things that I wanted to tie into treating your own neck. By the way, this book was written by Robin McKenzie, and you can get it online at the McKenzie USA website, or you can also get it on the Amazon website. It's about a $10 cost for that book, and I highly recommend it. If I'm having somebody read the neck book and they're working with me in the clinic or with telehealth, then I generally am going to have them read to about page 23 so that they can get a basic foundation of all the information that they need in order to have success using this technique called mechanical diagnosis and therapy. It's also known as the McKenzie method. So this technique has been around for about 60 plus years. Robin McKenzie is a physiotherapist from New Zealand who's no longer alive. So sadly to say, though we miss him, that the Institute still lives and he still has international training in different parts of the world. So one of the ways that I wanted to relate this specifically to pelvic health is I wanted to give you a foundation of all the spinal issues that can occur that could potentially affect your pelvic health. So most of the patients that I deal with are complicated chronic pain cases, 90% of the patients that I see in the clinic are pelvic health patients, but I also see about 10% of other types of patients that have complicated pain conditions. And the main thing that I use to help these patients get out of pain and recover function in their whole body and including their pelvic floor is by doing mechanical diagnosis and therapy. So it first consists of an assessment of movement. These assessments, I usually do them in person, but for my telehealth patients, I absolutely can do these assessments over Zoom video call. So it works really well because I can tell you exactly how to do the movement, and then I can visually see what you're doing and I can assess what's going on with you, so we can also do that mechanical diagnosis and therapy at a distance. So this technique works really well for patients that can't come into the clinic for some type of reason. I've done plenty of reductions over the phone, even though I'm not seeing the patient. I've done plenty of reductions over the phone. I've done reductions over just giving people information by email. So this technique is perfect when it comes to utilizing pelvic health to help you get the best results that you're looking for. So for those of you who know a little bit about the nervous system, I just want to give like a brief overview of some aspects that might be related to pelvic health. So when we talk about a nervous system, we're talking about your brain, and then your brainstem and spinal cord, and then nerve roots, and then the peripheral nerves that branch off of your spinal cord. And for pelvic health, it is a full body kind of experience. And so I'm assessing the whole spine, cervical, thoracic, and lumbar spine. I generally start with the lumbar spine, which is why with my video educations, I have also started with the lumbar spine. I did give a little bit of a short webinar regarding how the whole spine and posture affect your function and also relate to pain. But with pelvic health specifically, I wanted to kind of tie in some concepts about the nervous system. So this diagram, basically what it's showing that there are two branches of your nervous system that are called the sympathetic system and the parasympathetic system. So this is the parasympathetic system. This is the sympathetic system. This is your brain, and how your brain is connected by these two systems and then affects your bladder. So your bladder is kind of like this balloon-shaped little muscle. It's called the detrusor muscle. And that is a very interesting organ. It is such a sensitive organ, and it is affected by so many different things in life. So I'm often talking to patients about the nervous system and how stress affects the nervous system. So there's different kinds of stressors that we can experience in life. First and foremost, in physical therapy, we're going to be assessing your physical stress. And then, other types of stressors in life would be like ergonomic stress. So if you have a workstation that doesn't support your body or your posture the way you need it to, then you might be, experiencing mechanical stress directly due to poor ergonomics. And I myself, I'm a physical therapist, but I myself have experienced ergonomic stress many times, driving in a car that doesn't fit right, sitting in a desk that doesn't fit right, not having the right height for your desk, or not having a chair that's adjustable enough. So, anytime I notice these kinds of things in my own environment, I am doing whatever it takes as soon as possible to bring my ergonomics to what it needs to be in order for my body to feel its best. And this absolutely does have an effect on pelvic health. I've had some patients tell me about their sitting postures and what they do to relieve some abdominal pain or some bladder pain or pelvic floor pain. And, oftentimes people are flexing. I think it's a natural instinct that we all have when we don't feel good, that we want to curl up into a ball and we want to just get into that fetal position. Unfortunately, if you are somebody that's in chronic pain and you've been demonstrating this pattern for years and years and years, you really can get stuck in that position, and that can cause all kinds of problems with your body. It can upregulate your nervous system, It can cause you anxiety. It can cause you, changes in your mood. It can make you extremely irritable. It can affect your cognitive abilities, and having all of that stress in your body for years and years and years, it's absolutely going to take a toll on your immune system as well as your hormone system. So a lot of my patients coming in, they do have hormone imbalances because they've been under a tremendous amount of stress on all different kinds of levels for many, many years. Okay, so going back to this diagram, the other side of this picture is talking about the voluntary nervous system. So when I was speaking about the parasympathetic system and the sympathetic system, that falls underneath the autonomic nervous system. And so the autonomic nervous system is what I always refer to as the automatic nervous system. And the functions that are underneath the autonomic nervous system are functions that we do not have to tell our body to do. Like, you don't have to tell your heart to keep beating. You don't have to tell your lungs to keep working and metabolizing that oxygen and getting rid of the CO2. You don't have to tell your diaphragm to contract and expand. Although I will say one thing, I work on a lot of diaphragms. Lots of people, almost all of my patients, have diaphragm dysfunction because of, number one, poor posture, and number two, loss of spinal mobility. So if somebody has a loss of spinal mobility in a certain direction, that can directly affect the function of your diaphragm. Your diaphragm is a really important and interesting muscle. It is a umbrella-shaped muscle that's underneath your rib cage, and it has attachments that are tendons that attach to your thoracic and your lumbar spine. And it's a huge important component of pelvic health. If you are under a lot of stress and you're breathing abnormally, and a lot of us are breathing abnormally right now because we're wearing these ridiculous masks that are messing up our oxygen and CO2 exchange and sending a lot of people into, flight or fight modes. Wearing these masks, it's inducing flight or fight. Okay, so flight or fight, that would fall under the sympathetic nervous system. Okay, so being in flight or fight is like rushing, having too many responsibilities on your plate, being constantly stressed out, being on the go, not getting enough downtime. And so when we don't get enough downtime, our nervous system can stay upregulated and cause all kinds of havoc. We do not digest well, we do not eliminate well. If our flight or fight is constantly going, some of the functions in our body are going to struggle, and that is going to have a direct impact on your health and potentially lead to disease if you do not get some help by somebody who knows how to treat these problems. So the parasympathetic system, I know that probably all these words are backwards because that's how it works when you do a selfie video. But the parasympathetic system is the opposite of the sympathetic system, and that is the system that kicks in when our nervous system finally gets a chance to downregulate. And then the things that happen in our body when we downregulate is that we can fall asleep. Our GI systems work great, and we perfectly digest our food, and then we have no problems eliminating bowel or bladder. And so all of that happens in the parasympathetic phase of nervous system activation. So if you're not getting good sleep, if you're in a lot of pain and it's waking you up multiple times a night, or if you have a bowel or bladder, more commonly it's going to be a bladder problem that wakes people up frequently through the night. And when you wake up frequently through the night, you are breaking up your REM cycle of sleep, And REM is that rapid eye movement where you are going into your deepest phase of sleep. And that is where so many amazing things are happening in your body. Your systems are resetting and your nervous system is getting down regulated, because that has to happen in order for you to go to sleep. And then when you're in that very deep sleep and you're producing these delta brain waves, and your body is going to be able to renew itself. You're going to have cellular regeneration, your tissues can heal better, your body is going to start working better for detoxification, because even with your lymphatic system, which helps us to get some of the toxins out of our body, that needs to be down regulated as well. If our breathing is erratic and our diaphragm is all dysfunctional, then the normal action, pumping action of our diaphragm is disrupted. And so that has a direct effect on abdominal lymphatic circulation. Also, the diaphragm, it's perforated by 3 major vessels, in addition to your esophagus that has a little opening. There are 4 little openings at the top, different little openings at the top of your diaphragm that are little pathways for your vena cava to go through, for your aorta to go through, for your long thoracic duct to go through, and then your esophagus. So if you are really tight in your diaphragm, which is kind of like that middle place between your thoracic and lumbar spine, then that tightness, it can be so nasty. It can be like a tourniquet on those vessels, and it can also squeeze off your esophagus. And so sometimes people get some weird symptoms because of that. Sometimes that is part of what's happening and going on with people who have a condition called GERD. A lot of times those people have some issues with, acid coming up and things getting really tight and sticky in there. And usually there is a really tight diaphragm that is associated with that condition. So we have all levels of our spine affect pelvic health. And so oftentimes when I'm working with patients, I will start with lumbar scan first, then thoracic scan, then cervical scan. Sometimes I do those at different visits, but if the patient or the client can move really well, I can test all 3 of those areas in a matter of a few minutes. A lot of my patients are in really bad condition, the ones that I see in the clinic, and some of them have some pretty serious mobility issues, and their symptoms are so severe that I have to work very slowly and carefully with them. But most of my telehealth patients, they're in much better shape and they can move around. So if you are one of those people, or if you're one of the other people who doesn't move very well, either way, whatever your situation is, I can evaluate your condition via telehealth. It's not an issue at all. It's nice to see people in person, but when I can't get to people in person and when people have not gotten the care that they need, then telehealth is a great way to go, especially during these times where a lot of people can't get out of the house, they're scared to get out of the house, or they maybe live in a remote area where they can't easily get to the city to find a highly skilled clinician to work with. So that's one of the reasons why I'm doing this, is because I want to be able to reach people wherever they're at. So there's more here on the nervous system. So we just got through talking about autonomic nervous system, and then we also have the voluntary nervous system. So the voluntary is going to be all the things that we consciously control. That would be like if you have to go to the bathroom, you're going to be like, I got to go to the bathroom, and you're going to start looking for a bathroom. And you're going to tighten your pelvic floor in response to feeling your urges to go to the bathroom. And so that control of tightening your pelvic floor under that circumstance is a voluntary action. Some other voluntary actions, just so that you understand the difference between automatic and voluntary, is anything that you can tell your body to do and do it, like get up and run, that's voluntary. Sometimes people with pelvic floor issues, they lose some of that voluntary control in their nervous system, and they want to hold it, but they can't. Their muscles aren't strong enough, or they have some pelvic floor dysfunction, which would be like muscular tightness due to adhesions and also related to so many other things, can be related to all kinds of behavioral issues that a person has developed, as well as history of trauma, sexual trauma, physical abuse, all different kinds of trauma, including somebody who's, a snowboarder or a skier who's fallen on their butt and had tailbone injuries again and again and again. A coccyx injury, so coccyx is another word for tailbone, that can be traumatic. If you have fallen on your tailbone once or 100 times, you can end up severely disabled and in a ton of pain from having a coccyx injury. So if you have had a slip and fall onto your butt at some point in your life, then I highly recommend that you stop hiding that problem and go tell your primary care physician that you want to see a pelvic health therapist. That is the best person to treat this problem. And then the second best person to work with is going to be someone who's trained in mechanical diagnosis and therapy. Because if you've been in pain for a long time and you've been seeing providers and you still don't know how to get rid of your pain, then you are missing a big integral part of your therapy. And that has to do with learning how to use the concept called directional preference of movement so that you can be on the road to getting out of pain. So, another thing that I want to stress about this book is that there are a lot of you out there that sit at a desk all day long, and you might be experiencing some symptoms like in your wrists and your hands. You might be experiencing some weakness, you're dropping objects, or you can't hold on and grasp hard enough to hold on to an object. So if that is happening to you, probably the most common thought that's going to come about if you have those symptoms is that you might have a carpal tunnel syndrome. One thing that I want to stress is there's lots of people that have carpal tunnel like symptoms. And one of the things that I want you to know is that if nobody has looked at your neck to see if some of those symptoms are radicular and then traveling down your arm into your hands and wrists, then you really need to get to a person or call me, get to a person who knows how to do the mechanical diagnosis and therapy so that someone can assess your directional preference of movement and rule out if those symptoms are actually a cervical problem or a true carpal tunnel problem. If you have been diagnosed with carpal tunnel, make sure that someone has done a nerve conduction study on you. If you have not had a nerve conduction study done, make sure that your doctor or whoever conducts that test, make sure that they order it so that when you go to get your test done, they test you all the way from your cervical spine all the way down into your carpal tunnel. Because if you're getting a nerve conduction test and they're just testing you from like the elbow to the wrist, they're missing half of the nerve pathway. And so you might be getting misdiagnosed and you might be going for a surgery that is not the surgery that you need. And maybe you don't need surgery at all. Maybe you need to get to the right person who can assess your movement and rule out if that is truly a carpal tunnel syndrome or if it's a cervical radiculopathy. I've seen lots of patients who have had carpal tunnel surgery and they still have their symptoms because nobody assessed their cervical spine. So very important to learn about movement and learn about how movement turns symptoms on as well as turns symptoms off. It's so important. It could be the best thing that's ever happened to you to understand this. It is so integral for your health to understand the importance of movement, because once you understand these concepts, you have a way better foundation of knowing what types of exercises outside of physical therapy are appropriate for you and which ones are absolutely not. So my passion for these subjects stems from working with lots of people who came to me, yoga students, yoga teachers, who were not getting better. They were injured themselves, they were teaching yoga, they have these pain or injuries that they are not recovering from. They've been some of my most challenging patients to work with because they come in and they're super fit, and then they're extremely knowledgeable about anatomy and the human body, but they don't have any experience or training regarding knowing what directional preference of movement is. And for this specific technique, physical therapists are the only ones that are trained. And I don't know if this is still true, but chiropractors used to be able to go get MDT training, and I'm not sure if they can still do that or not. But I know that other types of clinicians are not allowed to do this training. This is nearly strictly a technique that you can only be certified in if you are a physical therapist. So a physical therapist is who you want to see for this problem. And like I said, I have known about some chiropractors that have been certified, but I'm just not sure right now if the Institute has continued to certify those practitioners. So I hope this has been informative. I've been in touch with some of you about chronic pain, and I know that, it is a long journey, and it's not something that people generally just suddenly recover from overnight. It is a process, and there are some people that it's going to take years of therapy of getting out of these problems. I had a problem that stemmed from a head injury that injured my neck, and it was a problem that was in disguise for over 30 years, because having neck pain was not my main symptom, but my symptoms were definitely related to this injury, this head injury that I had, that jarred my neck and caused me almost a lifelong cervical dysfunction. And I had all kinds of horrible symptoms and disability related to it. And I one day was like, what the heck, maybe I have a cervical mechanical issue that's causing me these symptoms. And the symptoms were mostly all in my head, but then what clued me into like neck problems is I've had whiplash a few times in my life. And so I knew that there was something that I wasn't quite getting to in my neck, and I diagnosed and treated myself. It took me a total of 3 years to completely get out of symptoms and off medication. And then I'm still not constantly, but I still continually manage this problem on an ongoing basis. And that keeps my symptoms from returning, which is a huge relief to not have to rely on medications, to know exactly where my problem is coming from and how to use different tweaks and hacks on how to change what I'm doing with my exercise program as needed, as my symptoms sometimes change. But one thing that you will discover when you're using this technique is that you do generally have a pattern. Okay, so you will have a pattern of tightness or restricted movement that is there. It's chronic for those who have chronic pain. It'll be this consistent pattern of restriction or loss of motion that you have. And so when you start learning mechanical diagnosis and therapy, you're going to learn what that pattern is, and it's golden. It is a key to success, because you will keep using a pattern of movement again and again and again to get relief until your problem shifts and changes. And when your problem shifts and changes, your body will tell us that it's time to move in a different direction, and then we can reassess the movement and we can find out exactly what the next movement is that your body wants to do to feel better. So this technique is hands down the bomb. And if you are in pain and you haven't experienced getting relief, then you need to get with a mechanical diagnosis and therapist who has plenty of training to help you feel better. All right, hope to see you soon, and thank you for tuning in.